How did you start?
We're the oldest aid service organization in the world. We were founded in 1981. About half our money is government money. Most of that's federal.
Since the word sequestration came into our lives, all of a sudden we found every single federal grant, and that trickled down to the city and state level grants as well, cut.
One government contract cut $80,000. One cut $100,000, $64,000, $59,000, $320,000, $198,000, $456,000. It's a little overwhelming to see this.
You want some chicken?
We had to cut our food pantry bags by 47%. We had to lay off a counselor in mental health. We cut our individual counseling sessions for substance abuse by 20%. We cut our mental health counseling sessions by 10%. We had to cut 500 hours of legal counseling services for clients. We had to lay off a kitchen worker. We had to lay off a Spanish nutrition counselor. It was pretty big cuts all around.
Every single aid service organization was cut. So who are we referring to? Our sisters and brothers are bleeding just like we are. About 75 to 79% of our clients are living below federal poverty levels. They have no other resources. And this is where they get their full service of needs met. And frankly, start to get sustainability to move forward in life.
You get sick. I used up my savings, cashed in whatever I had to live off that, and didn't want to go seek help from anybody, and I became a hermit. And then it got so bad, I really needed help, and somebody talked me into coming here.
Last month, I think we served about 250 people.
People have a greater need. They're coming in, and we're having to give less because our budgets are not allowing us to give out what we used to give out. They're grateful for what they're getting, but I know they need more.
Folks that need social services, poor people, people with health challenges, we tend to be shuffled back to the back of the list.
We've made a lot of progress, and there's a cry out that there should be an end of AIDS by the next generation. And the less we're funding and the less we're supporting the efforts now, the harder it is for us to ever reach that end to HIV.